Hello everyone, it's Mo here, and today we're going to be kicking off respiratory medicine with the discussion of pneumonia, exploring the different types of pneumonia and how we can treat them. So, without further ado, the definition of pneumonia is inflammation of the substance of the lung and can be caused by bacteria, viruses, and secondary bacterial infections, or even fungi. It normally presents with a constellation of symptoms. The typical features include a cough, shortness of breath, bringing out green sputum or yellow sputum, a fever, and the typical things that you will see on placements and even on paper in your exams. But in the elderly, for example, it can present with none of these features and just tiredness or even being off legs. Pneumonia is either a clinical diagnosis or a radiological diagnosis, and we tend to treat or assess treatment based on the resolution of these two parameters. You have two patterns of disease, typical and atypical. Typical community-acquired pneumonia is literally typical. It's what you see and what you associate with pneumonia, and it's normally caused by strep pneumo or Haemophilus influenza, and is identifiable on blood culture, or more specifically and more commonly, sputum culture. Atypical is a little bit trickier, and actually is probably the stumbling block in your exams. So you have Legionella pneumonia, Mycoplasma pneumonia, Klebsiella pneumonia, each having their own different features. So if someone has had a history of foreign travel, especially in a pseudo-Mediterranean country, maybe Spain, Portugal, with using hot water tanks, then think about Legionella pneumonia, especially if they've got a blood profile that has deranged sodium levels and even liver function tests. If someone has a weird and wonderful rash and also has features of pneumonia, think mycoplasma. If someone is homeless or is an alcoholic, as an example, and has got features of pneumonia, think Klebsiella. But these are the different types of pneumonia that they will tend to ask you in your exams. The key thing about treatment is that typical pneumonias respond to amoxicillin. Atypical pneumonias don't respond to amoxicillin. So we need to think about these two different types and differentiating them when thinking about management. Fundamentally though, whether you decide to treat someone in the community or admit them to hospital depends on their KERB65. So if they are confused, have a urea of more than 7, respiratory rate of more than 30, systolic blood pressure of less than 90 or diastolic less than 60, then they pretty much need to go into hospital for some IV antibiotics. If they have some of these features, but their overall score is less than 2, then oral antibiotics suffice. But if they are suspected to have an atypical pneumonia, then you give them clarithromycin, not amoxicillin. Of course, in your consideration about outpatient or inpatient management, don't forget oxygen saturations, because this is something that's not accounted for in the KERB65. So don't get tripped up by this. So that's it. Pneumonia. Atypical versus typical, and how to treat both of them using KERB65. So hopefully that's been useful to you. Until next time.